I'm Ariel, and we will be presenting rheumatoid arthritis and holistic care associated with it, and these are my fellow classmates.
I'm Shelby.
Mel.
Lydia.
Okay, so first I'd like to introduce what is rheumatoid arthritis. It's an autoimmune disorder that attacks the synovial membranes that line the joints, which causes things like painful inflammation and can affect things like the heart and lungs, so that's really detrimental to some of our patients if it gets to that point. It's a chronic and progressive disease, which really means one day it can be alright, another day it can be better, worse. It just really depends on the day. It's caused by a chromosomal defect, specifically in the X chromosome, which would make more sense that women are more commonly affected because women have two X chromosomes. But men can still get rheumatoid arthritis. However, when they do get it, they get more severe symptoms. The adult onset for rheumatoid arthritis is between ages 25 and 55. The juvenile onset is either between 1 and 3 years or 8 and 12 years.
I'm going to talk about the testing. There are different tests, but the main one used is rheumatoid factor. This is an antibody blood test, and if you get this test and get a negative result, it doesn't mean that RA is ruled out. The patient teaching for this test is that it takes 5 to 10 minutes, and there is no restriction, so the patient does not need to be NPO. The nursing implication is just look at their physical assessment, their medicine, if they are allergic to latex, and just and their symptoms as well. The sign of symptom of this disease is swelling, stiffness, fatigue, loss of appetite, and low-grade fever, and joint pain.
Okay, so unfortunately, rheumatoid arthritis is not curable, but the treatment kind of focuses on like the limiting the damage, loss of movement, and managing the pain, because it is a very painful disease. Some of the treatments can be holistically done. There is a little bit of, I guess, evidence behind the use of fish oil. There's two enzymes in the fish oil called EPA and DHA that are part of the omega fatty acids, and they have been shown to help the symptoms of RA a little bit. Daily exercise, you want to keep those joints moving, because if they sit too long, they're going to stiffen up and it's going to be even more painful. So that's kind of one of the things that can help treat the symptoms. Anti-inflammatory drugs, so you can use NSAIDs, like your ibuprofen and things like that. And also another thing that's commonly prescribed for people with RA are biologic and non-biologic disease-modifying anti-rheumatic agents. These work by targeting the cytokines on the cell surfaces, which they produce the inflammatory response. So these drugs will kind of inhibit that to hopefully bring the inflammation down on the joints. And then some other things that can be done, lifestyle changes. Diet was mentioned. You can do like a Mediterranean diet, which I want to say it's like some high proteins, more plant-based stuff. And then also you can do like acupuncture, which is a really good alternative medicine. You can do hydrotherapy, and then also the use of magnets have shown to do some good for the joints.
Next is health promotion and intervention. So one of the big things that are linked to rheumatoid arthritis is smoking. And they say that if you're at risk for it or to develop it, that you should stop smoking right away. Next is exercise. You want to keep your joints moving to prevent rheumatoid arthritis, and also control your weight, because the weight, if you have excessive weight on the joints, it's going to make it even more painful if you develop rheumatoid arthritis. And then lastly, you want to avoid environmental irritants or agents. They have done a study that a majority of people that have rheumatoid arthritis were exposed to some type of agent at their workplace, such as like asbestos. So if you work in a place with chemicals or asbestos, I can't say the word that well, you want to make sure to take precautions and not get exposed to it and limit your exposure to prevent rheumatoid arthritis. And then lastly is the psychosocial issues associated with rheumatoid arthritis. The big thing is a loss of independence. They're not able to use their hands as much because of the rheumatoid arthritis, which could prevent them from doing their job, which means they would lose their income. Also, they can't do everyday stuff such as eating or brushing their teeth. It restricts them with their physical activity. The next thing is their self-image and appearance. They feel that people are looking at them and that they can see their rheumatoid arthritis in their hands, so they fear going out. They have anxiety about it. They get depressed, and so then they start having a depressive state. And it can also decrease your sexual activity because you don't feel as good about yourself. Also, you can have anger, even though you're upset about the pain or the fact that you have limited mobility. You use your anger out on people, even though it's not because of them. It's really because of your side effects to the rheumatoid arthritis. Also, it can be a strain on family, friends, or a caretaker because you've lost your independence. Now you rely on other people, and now they're having to do their own things, plus take care of you, who have rheumatoid arthritis, and they feel that that's a huge strain on them, and so they've got more on their plate. And then also there's a couple support groups that go along with rheumatoid arthritis. If you go on Facebook and just Google rheumatoid arthritis, well, not Google, you would Facebook search it. There's many groups that come up on Facebook, people who are at risk for it, people who have it, and there's so many people right in your community or people all over states that will support you. And then there's also the rheumatoidarthritis.org, which is an organization for people who have rheumatoid arthritis. And you can go on there, you can talk to people live right then and there. You can get advice from doctors, from people who have it, and it's a really good resource for those who have rheumatoid arthritis. And there are our references.
Thank you.
Thank you.
Thank you.